Zoll Medical, these are your new crash cart defibrillators. We call them crash cart code ready because they are ready for a code. Pads are hooked up. Also, if you notice across the front of the device, in these little windows right here, you have a green check mark. The green check tells us that at 2 a.m. this device turned on completely by itself if it wasn't being used. And it does this big system check and everything passed and everything's okay. We also like to see green lights on. Always make sure you have green lights. That way you show it's plugged in, it's full charge, and it's ready. That way when we get ready to use it, if we need to unplug it and take it to the patient, then we have 4 hours worth of battery life. So we have a lot of time to work with this device. Anybody here do crash cart checks? Okay, I'll show you how to do those. Those became very, very easy now. If you come in and there's a green check in that window, you know that it already did it and everything already passed. If you're still going to do a manual one, you probably are. They'll let you guys know when these come out. The manual one became very easy. Now you just do your 30 joule test shock directly into the package. You don't have to unplug the pack and plug it to the shock block anymore. So your daily test is really simple. Also, if there's a red X in that window, there'll be an explanation in this screen and also a printout that tells you what the failure was. The two things you fix, we cause. We don't plug the pads in. So when it tries to do that 30 joule test shock at 2 a.m., there's nothing to shock into, you can't do it. So it fails the device. Second thing that you will fix is if we unplug it and don't plug it back in, as soon as this device starts seeing a battery drop, then it's going to know, hey, someone needs to plug it in, I'm not full charged anymore. Also, you won't have the green light, so that's a really easy one to see ahead of time and eliminate from happening. You come in, there's a red X, explanation, you put the pads on, you plug it in, whatever it tells you need to do. You take the device and you turn it to 1. You come over to your energy select bar, you go down to 30 joules, it shows right here. You go to 30, you press the charge button, and you do your test shock right into the package, and it says right here, 30 joule test done, 30 joule test okay. It's trying to print a strip. I intentionally have those tucked away because we're teaching class after class. I don't want to waste all y'all's paper, but this is what it is printing out, and it shows that it passed and you fixed the problem. Okay? Any questions with that? 30 joules is the word. Okay? Let's say that you turn this device on Monday morning, you come in, there's a red X, you put the new pads on, you plug it in, whatever the issue was. You turn this device on and you forget to go to 30 joules. No big deal. You go on, and as soon as you turn it on, it immediately goes to 120 because it has adult pads. It's ready to shock at 120, and you go ahead and charge it. It's starting to tell us. You hear that double beeping? It's telling us, go to 30 joules, go to 30 joules. It's telling us that we're messing up. But you go ahead and try to shock it because you're not paying attention. It won't shock. So you're never going to like blow these up in your hand or melt them down or anything. It just will not shock. Anytime this device is charged, whether it's on a patient or in this case in a test, and you want to get out of that, in a minute it goes away. We're already tired of hearing it. So what you do is you go to your energy select bar, go down one setting, and it shuts the shock off. Patient felt nothing. And then in this case, you'd be like, oh, that's right, 30 joules. So 30 joules are the trick. You guys are used to that because you already have one of our older devices and it's 30 joules on it. So it's not going to be that new to you guys. Pad placement, that's a little bit different on these. Anterior, posterior, or what you're after. They have a nice little picture on them, but always kind of familiarize yourself prior to a code. If you're like me, it's kind of hard to read directions or follow pictures or diagrams during a code. Pad 1 goes behind the heart, right there. Pad number 2 goes on the front, and it goes in a specific spot. This one's a little more detailed because we actually do our CPR directly on the pad now. If you notice on my mannequin and on yours, this is about where I'd want to do my compressions, right where this pad is, and that's completely right. Pads open, yellow arrow, pull them open. Pad number 2, you do CPR directly on top of it. So when I put the heel of my hand on that patient and do my compressions, that's where this part needs to go. So when I grab the red tab to pull them out of the package, one thing I want to show you is you're going to see that test strip pull loose. So when you pull these out of the package and this wire pulls out of the back, it's not broke. That's the test strip. That's how it does the test shocks into the package now.
So what are you going to do
that
like,
wire's here.
if you have a large-breasted lady? Because how that's going to be folded over right there.
Yeah, go ahead and lift it, just like if you were doing like an EKG, you know how you go stick her under.
Yeah.
Go ahead and lift and put this on, and then just let it go back over it.
Okay.
Yeah, and then that way this is down as close to the core of the body as you can.
Okay, because I'm like, I see that this is all connected, so you can't even
Yeah.
move this pad anywhere, because this is not gonna be the right place.
That's correct.
Yeah.
And that's a very, very legitimate question, but like I said, just like an EKG, and there is a little picture of that, but there again, it's hard to see that in the code.
Yeah,
There is a little picture showing that. Lift the breast, put it on, it can lay right on top of it, then the shock is going to penetrate.
okay.
Good question. Any other question on these? Anybody in the ER? Use the Lucas, and this is
Yeah.
going to be right in the way. So what we can do there, even though it looks like it's one piece, and it is, it's not Velcro like the trainers, you can see it's one piece.
Yeah,
You can see it's only attached by a little bit. So if you need to move this, say that you're doing CPR with the Lucas, well then this is the depth and the rate. This part of the pad tells us how good our CPR is. The Lucas doesn't mess up. It does the right depth and the right rate. Even though this is attached, you can grab it and pull it loose,
okay.
toss it off to the side, put it on. Lucas goes right here, and you do CPR. So this can come off. It is attached, but you can rip it off. It's not attached by just a little bit. So it is designed to be able to be removed. Okay? Another thing I want to show you on these pads is when you put these on, you also, where's my other one? 3 leads are built into them. So let's say that you have a patient who's spiraling, you're not sure where he's going, but we're going to pad him up because he's going to code. You put it on and all of a sudden you see a block or he's super Brady and you want to pace him up. 3 leads are on, you don't even have to put 3 leads on anymore. They're built into these pads. So these pads, when they say CPR 1-step completes, they're not joking. You can work a code, you can cardiovert, you can defibrillate, you can pace, you can do everything with them. Okay? It's really nice, really simple, keeps everything really smooth. Any questions on pad placement? Let's go ahead and take these loose, and then we'll hook up to our mannequins. This is about the trickiest part of the class. I'll show you a really nice little trick, and then we'll go from there. If you take a look at these, on this end of the plug that goes out to the pad, there's a little lever right here. On one end, there's 4 lines. If you take and push on the 4 lines with your thumb, I just remember that as like the skid resistant. That's where I push down. You push down, you can feel it pivot. It pivots up, releases a pin, and then grab it. Give it a good big snug pull, and they come right apart. The biggest mistake I see is we just don't pull them hard enough. They definitely are tough to pull apart, especially if your hands are slick. We make them by design like that. The last thing you want is for these to come unplugged during the code. Imagine if we tripped over this during the code and unplugged everything. So when you get them apart, keep the red plug in your hand. And then if you look around your mannequin, I tried to lay it right across the stomach of all of them. There's a plug. We'll plug into our little rubber mannequin guy, and then we can have our class with him the rest of the time. The good part about this is we never do this during a code because they're already hooked up. Remember at the very beginning, we keep these hooked up 24/7, 365. But during a code, all we do is open them, pull them out of the package, and put them on the patient. After the code, eventually we do have to take them loose, and so that's when we have to actually do the plug. I'm going to turn my device on. If you leave yours off for about 2 minutes, I'm going to show you a quick demo how we would start a code. Then we'll turn your devices on, and then we'll have yours on the rest of the class, and you guys can push buttons and really learn these things inside and out. Across the front, we always look for green, green, green. We already know that. If you look down here below, we have this main big dial, and that guy does everything. If we're wanting to go into red, that means we're wanting to work a cardiac arrest. If you're in red, the rest of these don't even work. Forget about them. If you're wanting to monitor, you turn it into the gray. Then you can use these monitor keys. If you're wanting to pace, you turn it down to green, and then we forget about all these. So whatever mode you're wanting to use it in, you turn to that color, and then you just worry about those color keys, and it simplifies it a lot. So during a code, we don't even worry about these green. We don't worry about the red. Look how much simpler mine looks than yours to run now. Not very many options, and that's what we want during a code. We need it to go very smoothly. Also, we've numbered them. Move number 1 is to turn it on, and that points it to number 1. Then we slide straight up the keyboard, and then the option number 2 is the next one. This is our biggest decision here. If you know it's shockable, and you want to charge and shock, press the charge button. I tell people, if you want to be in charge, push the charge. If you don't, and that's totally fine, I personally don't like to. I like for the device to make decisions for me. Then you can press Analyze. What that Analyze button says is, please analyze this rhythm for me. Take it. That puts it into an automatic mode. At that point, it analyzes. It charges. If it's a shockable rhythm, it tells us to press shock. It keeps up with our timers. It chooses the shock level. It does everything. If I charge it, or if the device charges itself, then option number 3 lights up. A noise is like a squealing sound's going, and it says press shock. And then we press the shock key and we go forwards. Okay? What I'm going to do at the beginning of this code, I'm going to use it in the analyze mode, and we'll go from there, and then we'll go into manual procedures. Patient goes down, I'm doing CPR. Crash cart gets there, we open those pads, we put pad 1 on the back, we put pad 2 on the front. I'm doing CPR directly on the pad. We take this dial and I go to 1. It immediately turns on, rhythm immediately shows up, and I'm going to go ahead and go up to option number 2, and I'm going to press analyze because I want the device to tell me how to run this code. At that point, that's all I have to ever remember. From this point, he talks me through it and tells me everything I need to do.
Press shock.
Told me to shock. He chose that it was a shockable rhythm. Chose a shock level. All I do is clear and shock.
Perform CPR.
In case I forget to do CPR, he tells me to do that as well. I start doing CPR. In this purple area, you're going to see the real benefit of these pads. The part under my hand is giving me all those numbers. The first set of numbers is the
Push
depth.
harder.
American Heart Association says 2 to 2.4 inches deep.
Good compression.
Rate 100 to 110. That third thing that fills up, that cylinder, is filling up from the bottom. That shows that I am pressing and releasing. Good recoil. We have to do that. The diamond fills up on this side, shows that we have built the blood pressure. We're pushing blood through the body. I start getting out of range, I get tired, I get too fast, too shallow, too deep. He starts highlighting in yellow and he starts talking to me. So hopefully during the code you'll either be able to hear it or see it. Get back in those ranges. He's happy.
Good compression.
Yellow goes away and we're doing good compressions. American Heart says 2 to 2.4, 100 to 120. If you're at 2.5 inches deep, it's going to highlight in yellow. That's not the end of the world. But if you look up there and it's highlighted in yellow and you're going 5 inches deep, way back, bring it way back. We don't want to crush people's sternums anymore. And when you do CPR 4 or 5 inches deep and you crush their sternum, it doesn't recoil then. So we can't break things. We try not to. The big guy, we used to say, oh, big guy, bury it up on him. Somebody twice my size is boned mid-sternum, just like I am. So we don't need to go up to here on the big fella and break him up anymore. Like I said, we want it to recoil. We want to leave something in there, okay? Clock. As soon as I quit doing CPR, it starts counting. That's how long it's been since I've done my compression. Keeps us honest on that 10 seconds off the chest. Down here in this corner, there's a clock counting. It started at 2 minutes, and it counts down
Press analyze.
to 0 and brings me through the next cycle.
Stand clear.
We go again. First shock was 120. Second shock, it automatically escalates to 150 because the first one didn't work. It upped it. I shock at 150.
Perform
Do
CPR.
my CPR. Next shock is going to be at 200. It automatically goes up to yours as well. Anytime you want to be in charge, say you and I start this code and we're using it in that automatic mode, and that's great. We're happy with that. Physician comes up, provider, whatever sort, and they want to change things around. You just go to the manual side now. Say they want to shock at 120 again for some reason. Just go over here and you go down to what you're asked. And you charge it now. Notice I don't have any audible cues anymore. It's not telling me to press shock. It's not telling me to press analyze. We're in charge now. I press shock. Doesn't tell me to do CPR. I have to remember to get back on the chest. The one reason I really like the other mode myself, the timer's gone in this mode too. So if you do compressions for 30 seconds or 10 minutes, it's up to you now to do those rhythm checks. But you are in charge. It's all manual now. That's totally fine. Use it either way you want to. Run the code from there. Any questions? We're going to turn these on. You're going to start pushing all those buttons. I'll help walk you through what I've done. It's all going to start really kicking in. You'll start really understanding this device. If we take the SIM boxes, little black and white button on top, we'll turn those on. Slide down the left-hand side, second button down on the left says CPR with artifact. Press that one, and you should have a green light that comes on. Everyone feel good with pad placement? Anterior, posterior? Everybody have a green light on that CPR with artifact button?
Nope.
No? That's-
Oh, we go, okay.
You got it?
Yeah,
Okay,
that's
good, good, good. And your device may have already been on. When you
Oh,
pushed it,
okay.
it may have turned it off, so yeah. All right. Pads are on, we're going to town. We're doing CPR. Let's take our devices, let's go to 1. Let's slide up, and to start this show, let's press analyze and put it in that manual mode.
Stand clear. Clear.
Press
Stand
that,
clear.
just do what it
Stand
says.
clear.
And there, it's in charge, it's gonna walk us through it.
Perform CPR. Perform CPR. Perform CPR.
You don't have to do a bunch of CPR, but if you will, try to get those 2 to 2, 4, 100 to 120s. Try to get out of the yellow.
Push harder.
There we go.
Push harder.
You're welcome. How's that?
Good compressions.
You see good?
Push harder.
How's that? Is that better?
Push harder. Push harder. Good compressions.
Try to get away with the yellow. 2 to 2, 4 deep. Get your first set of numbers right. When you get that dialed in, then look at your brake. If you're going too slow, keep the
Push
same
harder.
depth,
Push harder.
but push a little faster. If you're going too fast, slow down a little bit.
Good compression. Good compressions.
Good compression. Sounds like everybody's dialing in on it.
Yeah. How many do you want us to do?
About 20
harder.
minutes.
20 minutes.
No. You don't have to do any more than you.
Good push harder.
It's fine.
Okay.
If you guys notice, when you stop
Good
doing those
compression.
compressions, you see those clocks going? That
Mhm.
keeps you honest on that 10 seconds off the chest. Everybody see the little clock down in the corner going?
Yeah.
Okay. So let's do one more thing. Let's go down to this bottom, this row of white keys. Go to the left. You will see where it says options. Press options. And then it says QRS off. Yes. Press that off button. And that turns all those QRS volumes off. One more push. Options. And then if it says on, press it.
I'm trying.
There you go. Press it one more time. That time, one more time turns it off. Cool. It's what you want it to do. It's kind of weird, okay? Let's say a physician comes up and says, charge at 200. Let's go to these energy selects. Let's go up to 200.
Press analyze.
We're at
Press
200.
analyze.
Press those charge buttons. What we just did is we just
Stand
took
clear.
it out of the automatic mode. Now we press those shock keys. And we are doing CPR.
Perform CPR.
They're in manual mode now. Go ahead and press your charge key on yours. Yours is still in auto. There you go.
Oh,
Now
I
see-
already shot. I hit it again and shot.
Oh, okay.
Yeah.
And then hit your, there you go. So now we are in a manual mode. So if we forget to do CPR, it's on us. If we forget to keep up with our timer, it's on us now. But we're in manual mode. Pediatrics, anybody in peds or ER? Peds, you may be arrowing down to 30 joules. Peds is a little more precise because all adults, 120 is a great start. If she has a 6-pound peds, she may want to shock at 20 joules. If she has a 100-pound peds, want to shock at 120 joules. So always go, anytime you want to, go over here, go up and down as you want, charge it where you want, and go from there. Any questions in the automatic or manual modes? Let's go ahead and go to our devices. Let's slide down the center row to the second one. It's AFib. We're done with CPR. If you guys want to kick back again, you can. You can stay up, whatever you want to do. But we're done doing compressions as far as I'm concerned. So everybody have AFib on your device? So what we want to do is we want to do a cardioversion. So what we want to do is we want to sync up. We want to get it synced with this heart rate. You see the highlighted sync button down at the bottom on the white soft key? Press that, and you'll see now it says sync on the screen. So now we know that it's going to sync up, and it's going to be deliver a different shock than the defibrillation. You see sync there also, always verify 2 forms. You also see the R waves marked with a white dot on top. Let's go to energy select. I'm going to go to 75, go to whatever you want. Choose a level. Go ahead and press your charge keys, and press your shock key until the shock is delivered. the shock is delivered, the light goes out, the alarm goes out. Sedated or not, that patient's going to give you a little reaction. Just be aware of two things. One, as soon as you do the cardioversion, it goes back to defib mode. So if you need to do a consecutive one, sync each time. Verify you see the word sync, verify the ROA is marked. Also, second of all, is you have to press the shock key until the shock is delivered. These SIM boxes, it finds it very quickly. Real world, real patient, when it's charged, you may have to press this for a second or two or even three. And it seems like an eternity when you're waiting for a shock and you're pushing this. It's looking for something. It's getting in sync. It's looking, it finds it, boom, it shocks it. So be aware to push that until the shock's delivered. The squilling goes away, the light goes out, and the patient's going to give you a little reaction. Any questions on cardioversions? Feel pretty comfortable with that? Pretty cut and dry. The other thing I want to show you guys is these pads read impedance. So
I guess I have a quick question.
yes,
on that.
absolutely.
I work in a cath lab.
Okay.
Some of our cardiologists like pad placement, well, especially during a STEMI.
Yep.
Shoulder inside.
Do what you guys do now, and you're fine. These
Okay.
pad placements, this is best case scenario for CPR.
Okay. What about for cardioversion? Still okay to do side and, or I mean shoulder inside, or
The best,
or on front back?
front and back is the best for cardioversion, because that back pad shocks first,
Mm-hmm.
shocks the atrial. But you know, if they're there, they want to do it, do it, do it.
Okay.
Yeah. The best is the anterior, posterior, but you know, it's going to shock the patient either way. So do what you got to do. Okay. Any other questions on any of that? All right. What I'm going to do now, I want to show you that these pads read impedance. Let's go ahead and take these devices. Let's go back up to 200 joules. Take your energy select. Let's go to 200. And then let's go ahead and charge those at 200. When that shock is fired, look underneath the 200. Tell me how much it's actually delivered. I had 229 delivered. Press those shock keys. 233. You guys see different numbers? The pads read impedance. For years, we've tried to do guess impedance. Big guy, let's shock him a little harder than a little guy. That may work, may not. But the pads read impedance. The back pad shocks first. Boom. Front pad says, I didn't get 200. I'm going to up it on you. We want 200 in the heart. Impedance comes in a lot of different sizes and shapes. It's not always just the bigger person. COPD, he's a little bitty skinny guy. Scar tissue is insanely hard to penetrate. Bone density, we don't know the bone density. If you leave some hair underneath the pad, it eats up some of the shock. So these pads are biphasic. It shocks one way, shocks the other. The device is biphasic, I'm sorry. The pad shock, reads, and shocks. That way we get a lot better shocks, a lot better results at a much, much lower rate than we used to do. Okay? The other thing I want to show you guys is the pads also read, they filter out my artifact. So when I'm doing CPR, you guys know we always have artifact. So we stop and we let it clear, and then we get a good rhythm across, and then we read, we decide if it's shockable, we charge it, we shock it. We're supposed to be able to do all that in 10 seconds, which is virtually impossible. Okay? So what we do with this device, we do CPR, and we start getting artifact. If you notice on the devices though, that second waveform says FIL, abbreviation for filter. Look at my filtered line versus my top line. The top line I've got all messed up. I have no idea what my rhythm is. So you remember these pads, everything that comes from this piece under my hand goes into the purple. Filters it out. And so I actually get the true underlying rhythm at the bottom, which is a totally shockable rhythm, so I can go ahead and charge it. I've got my coronary perfusion pressure built up. Everything looks good. Stop for a second, verify if you'd like. I agree with it. Shock. 2-3 seconds off the chest. So during a code, watch that filter line. You can actually see where this code's going. You can say, yeah, we're going to keep shocking this guy. And you can keep things going. One thing about that, have your help lined up, because without those brakes, you're going to really cook through your compressors. But we don't want to stop and start the heart. 10 seconds are max. At 10 seconds, we're losing our coronary perfusion pressure. Think of a tire. You pump, pump, pump. You pump the tire up. You stop and the air starts coming out. Then you have to pump it back up. You stop, the air keeps coming out. Once we build that pressure, we want to kind of keep it as long as we can, so we want to minimize the time off the chest to absolute minimum. Okay? That's a lot of information in red, but we have covered it. Automatic, manual, you can see a different impedance, you can see a different amount given than what you asked for. Cardioversions, we sync, we charge and shock. During a code, we watch the filter line during CPR. That pretty well covers the red area. You guys feel good with that, or any questions? I know it's a ton of stuff. Let's slide back to the sim boxes. Let's go down the right-hand side. Second button from the bottom says third. And what that represents is a third-degree block. When we put these pads on, they cardiovert, they pace, they defibrillate, they tell the depth and the rate. 3 leads are built into the pads now. So when you put these pads on, you've also put a set of 3 leads on. So let's say we put these on, and all of a sudden we have a rhythm like this. We obviously need to pace this guy fairly quickly because he is going to code. So we take this device, we go down to green, we're in pace mode, pads are already on, the leads are on, so we don't even have to put 3 leads on anymore. They're built in and we're ready to go. We turn it down to that mode. If you notice at that point, then we have the rhythm up. You guys have rhythms like in the 30s, 36, 37, somewhere around there. QRS is missing, everything's out of order, everything's out of whack. If you notice in the pace mode, when you turn it to that, it says pace, waveform, the spike underneath, that is the offering. That's how many times, where my shock is going to come from. I'm going to take my rate dial over here. We'll just turn some buttons. Let's take the rate, change the rate to whatever you want. It starts at 70. I'm going to go up to 80. That's not clinical, but just get used to where you're turning and where it shows up. I have 80 a minute going by. My heart rate's at 37, so I need to start adding some power. Milliamps, what we call that. You take the milliamps, it starts at 0, so let's start turning that dial and watch your 0 start climbing. I'm at 10, I'm at 12, I'm at 16. How we know when we have capture is by looking at the waveform. There's not a magic number like in the defibrillation or something. It's by recognition of the waveform. If you keep going up, I'll give you this much of a hint. The sim box picks up at 48. So go up to 40s, slow down. Watch that waveform when you hit that 48 to 50 and see if you see like a really substantial difference. What we're looking for is after each spike, we're looking for a white QRS complex. That represents a stimulated heartbeat that we shocked and made his heartbeat. Does your rate up here in the ECG box, does it match what you've asked for down here below?
Mm-hmm.
You've got capture. So all of a sudden we pulled that guy out of that situation. If you have a patient with a heart rate of 37, you're going to be doing compressions really, really soon. It's coming like right now. Once you get capture, go up about 10% more. Just a couple clicks are adequate. It goes up in sequences of 2. So if you got capture at 50, go up to 54 or 56. You don't have to get exact on the math. But we want to tilt the scales in your favor a little bit. If this guy starts coughing or sneezing or something and you're barely at the threshold, you can lose capture. So you want to shock him just a little bit harder so you hang on to it. Any questions with that? Everyone feel like you can recognize capture? Don't get caught up on the 48 because that's just the sim box. Okay? Every patient is different. We want to look at the underlying rhythm. You see that one more little green button down there, it says 4.1. What that says is when I push and hold it, it's push and hold by design, I'm going to drop 3 spikes in a row. So it's going to buy some strip time to see if he's jumping back in there and participating. So push and hold your 4 and 1 buttons. Watch that waveform. You recognize the spike in the white QRS. You're still there some. Is he filling in any better in between? Or does he still look pretty bad? Looks bad, you let go. You take completely back over. You never lost capture. And you got it.
Did the old Zolls have that?
So that is the way you check your underlying rhythms. Days of old, we turn the milliamps down, we'd lose capture. If he wasn't doing good, then we got to try to get it again. Usually the second, third time, it's harder and harder because he's not enjoying this. You're shocking this guy hard enough to make his heart beat. No one's having fun here, so you want to hang on to it. Once you get it, hang on to it, and don't lose the guy. Any questions with that? Everybody feel like you can recognize it? If you will need to turn this milliamps down, you want to lose it, you want to find it a few more times, make sure you're comfortable. When you are, we'll move on to something else. All right. Let's go back to our sim box. I'm going to go to this normal sinus rhythm, third one down on the left, and then we'll take the dial, we'll go to gray monitor mode. We've done everything we can do in red, we've done green. Let's go to monitor mode, and we'll go over some other keys, and then we'll get you guys out of here. We go to monitor mode. I think of these as kind of the non-emergent. You know, they need to be set, you need to change things, that's great. The red, you need to know, 1, 2, 3, cold every time. Pace, it's a little more relaxed. You got a couple minutes there if you need to ask your coworker, you remember how to use this pacer? We can kind of think a little bit. We go to this gray mode. This is super chill, super relaxed. This is where I set my leads. If I want to change the lead view, what I'm in shows up in the ECG box where you change it as lead. You got lead 1, lead 2, lead 3, pads view. That's where you change things around. The next one is size. That's literally the size of the waveform going by. If you want it smaller, if you want it larger. Where that really comes in handy is if when we start adding more waveforms, say we start putting 3 of them up there, we don't want them running over top of each other, you can kind of set it up how you want it. And that's where we do that at. The next one is alarm suspend. If you notice that the alarms have not been going off other than that QRS that we turned off earlier, all the alarms in each box, you can see the X's across the bell. We started in a code, they're automatically locked out because we don't need this thing alarming during a code. We're all on it, we know he's in trouble, we don't need this thing telling us. At this point, you can open those alarms. X's go away. Now if something goes wrong with the patient, we're monitoring, we want to know it. I want to make something go wrong with my patient, and you'll agree, I think, here in about 3 seconds, that you don't want these going off during the code, because they're and then you start saying to check patients over and over and over. If this gets open during a code, it's not going to be fun. How you get rid of that, press and hold it for 5 solid seconds. It flashes, then it quits flashing, X's go back across the bells, do it about 2 more seconds, then you let go, and it's actually gone. I'm not saying to lock it out and ignore it, but during a code, if that gets open, you're going to have to turn it off because that's going to grow old real quick. In a monitoring situation, open them, and then you would obviously run into the room and see what's going on. So, recorder. If you notice everything that happens, you hear that growling sound, it tries to record. Let's say that we were wanting to manually record something. Something goes by that we want to record. You hit recorder, it starts manually recording. When you're done, you hit it again and stop. At that point, you would have paper coming out the top. I have all this tucked away intentionally so we don't just print just reams and reams of paper. But at that point, it would start. The nice thing about this recorder is when you press it, it backs up 7 seconds. So if you saw some kind of a little blip there, you wanted to grab it, put it on paper, and it just went off the end of the screen, that's fine. Go ahead and hit the recorder. Backs up 7 seconds prior to you hitting it and records what was coming. So you can you can catch the rhythm. Across the bottom, more soft keys, all these white keys. Alarms, that alarm, that's where you go in to set your alarms to fit your patient. These keys I don't go over in real depth. I don't want to show you so many scenarios that we completely lose each other. When the devices come out, turn it on, push buttons, and just learn how to navigate, how to change your alarms and stuff. You just kind of learn that on your own. Report data, we'll skip that for a second. We'll go to code marker though. I'm in a monitor mode. If I hit code marker, there's some medications and some activities that I may be doing in that mode. If I choose to, I can hit it, puts it in a memory timestamp, and you can print it off later and see what time you did those activities. Parameters and options, that's your real steering wheel, if you want to say, to this device. That's where you really go in and change stuff around to do what you want. I'm going to add some waveforms. If you want to follow along with that, you can. I go to options. I go to traces. If I want to add more traces, go to trace 2. There's my choices. I can add my SPO2. Whatever you want to do. That's where you set the screen up the way you want to see it, so you can see what you're wanting to see. Parameters, there again, is where you work on things. Your non-invasive blood pressure, all those types of things, that's where you go to find those items. Say you want to set this device up to where you did a blood pressure every 5 minutes or 10 minutes or whatever, that's where you would go to, would be down here to parameters, non-invasive blood pressure, settings, auto intervals, that's where you change stuff around that. Push buttons, push buttons, push buttons, just learn the device. The nice thing about this device is no matter what you do to it, what you turn on, what you turn off, what you cancel, what you change, so when you turn it off for 10 seconds, you turn it back on, it says, okay, that code's over, we're going to reset for the new code. It goes back to factory settings, and you're ready to go. You won't go in and reconfigure the brain of it, so don't be afraid to push buttons on it and learn how to use it. Any more questions at all for this? We'll go over some more items. The paper we know comes out of the top. When the paper runs out, there's a picture in the bottom that shows how to load it. It shows a pack of paper. You literally take a new package of paper, you lay it on top, you pull it over, you shut the lid, and it's printing. There's a battery on top here, and this, if you want to see your battery level, you press where the finger's pointing, and it shows your battery countdown. Counts you down to 30-minute increments for the last 2 hours of the battery life. With a full battery, you start with 4 hours, so you got a lot of life. Down the back, you have non-invasive blood pressure cuff. There again, you can set it up auto, or you can use the stat BP button right here on the front left. A little universal button, arm with a cuff on it. Entitled CO2. This is what it looks like. It goes right in line. This cable is absolutely non-disposable. Don't throw that one away. The nasal cannula style, it's a nasal cannula and it's an end title. We toss it. Don't toss this. This is big bucks. This is the piece that you throw away. Use it on a patient and then toss it. It goes in a mask.
So just curious, how much, because I know it probably happens, how much is it?
About $1,000.
Oh, wow.
Yeah, for a cable. Yeah. So if you see your coworker unhooking it, say, whoa, 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 that one's not disposable, okay? End title, hooks onto ET tube, ambu bag fits on it, anesthesia bag, vent circuit, everything fits. This just simply snaps on it, and the numbers generate in the yellow box. Okay. It's zeroed, it's calibrated, it's ready to go. Don't unplug it. If you don't ever unplug it, you never lose it. You never knock it out of calibration. Everything's plugged in, zeroed, it's ready to roll. Just use it, leave it alone. Everything that's back here is plugged in for a reason. There's only one that you really ever need to unplug at all, and I'll explain that to you. Remember these pads with the 3 leads built in? On a crash cart, code ready, those pads are hooked up. Always, always, always. This plug is the hard wire to these. Today for class, we're using the 3 leads with the sim box on the table. In the real world, this 3 lead will be here. One comes with each device, and it's right here. This is plugged in the real world on a crash cart because we always have these pads in. These 2 plugs, this one and this one, come together as one behind this case. They come through this big, thick cable. One shocks, and one is the wire to your 3 leads. So when you start a code, you turn this device on. If you need to pace, if you need to cardiovert, if you need to defibrillate, whatever you need to do, it's ready. Let's say that for some reason you are in an OR or somewhere where you're using a pad that doesn't have 3 leads, like radiolucent pads don't have 3 leads because there's metal in the 3 leads. Or if you just want to put a set of leads on a patient, you can always unplug this one, just let it go. It's not going to get lost because it's attached. And you can hook your 3 lead up, just like we are today, and put your leads on your patient, and it shows up. When these pads are on, this plug is in. Okay? Any questions with that? Pretty cut and dry. Next we have your SpO2. Slip it on the finger and go. The next one right here, this shocking cable, we have a screw in the top because we design it. We want it to never be unplugged. We can't get there and be like, oops, it doesn't work. Why? We don't have time to troubleshoot during the code. We need a shock. We need shock now. So we went ahead and put a screw in it and make sure it doesn't ever come out. Any questions? Feel good with paper, feel good with the green pacing, feel good with the red.
There's peds pads too, right?
Peds pads.
Yeah, I was
Got
gonna
it.
ask about that.
We have pediatric pads right here. With the peds pads, when these are plugged in, the device knows they're peds, it tones everything down. Your first shock is 50, second one's 70, third is 85. If that's still too much, and it is, 50 is way too much for a 6-pound baby,
Right.
you put these on, you go to your manual mode, and you adjust down. What do you guys do?
Select defib mode.
Like 4 kilos,
Yes.
or 4 joules
4
per
joules
kilo,
per kilo,
something like that. So you guys would go over here and you would adjust anytime you wanted to. Also at the pediatric pads, the 2 to 2.4, 100 to 120, that's out the door. Because it's very specialized. A ped can be this big or a ped can be as big as I am. So obviously the compressions need to be different. This shows you your depth,
Uh-huh.
and it shows you what you have, but you choose what's right for the size of the child.
So that might not necessarily be, okay,
That's correct.
Okay.
Yeah, the 2.4, the 100, 120, that's out the door.
right.
You know, because you may be, if you have a tiny one, you may be doing inch
Yeah,
compressions.
after some,
You
yeah.
may have a peds my size and you're doing adult size compressions, so
Okay.
you need to know. These do not have the 3 leads built in because it's too small.
Okay.
4 pieces of metal that close, you just you
Yeah.
can't get it in. So if you put these on and you need to pace, then you would need to put 3 leads on
Okay,
because there's no leads built in those. Back pad goes right between the shoulder blades
Mhm.
instead of to the left side. Radiolucent pads, procedural pads, we have those as well. These are the, happen to be the radiolucent ones. Put them where you guys need to put them. They do the job. How you hook these up, they don't have all the big plug like this other one does. This giant part of the plug right here, this part is the feedback. This is where the depth and the rate and everything talks back to the device. This part here that sticks out further with the lightning bolt on it, that's the shocking part. So if you're using a regular procedural pad, you just plug them into that top and go to work. Okay? This part just sits here, no problem. Any other question? I don't have any with me. They didn't send any, but if you guys have internal spoons, I'm not sure if you crack the chest here or what, but if you do, they plug into that part as well too. And they just plug in. They're super simple, nothing to really
I think we
explain.
do have those set in the ER, but I've never seen them used.
Okay. ER usually has a little bit of everything because
Right.
what comes through the door,
Right.
it's yours. So you figure it out. I know NICUs, a lot of NICUs will have a set of those internals, the little tiny ones. Once in a great while when CPAP and stimulation doesn't get their heart going again, they'll occasionally shock with the internals because they don't make pads small enough to put on them. But there's the plug and there's what it is. Anything else? Any other questions? Okay. If you guys feel good with it, you can take the devices and turn them off. You can turn your SIM boxes off. And if you don't mind, unhook the mannequin. You can use that plug one more time. You'll get better and better every time. Put these unopened pads back on. That way it's just good practice. You remember to put them on. It's ready for the next class. It's ready for a code. It's ready for everything. And if you guys don't have any more questions, you're free to go when you want to.
All right, thank you.
Thank
You bet.
you.
Thank you. You're welcome. Thank you.
Have a good one, guys.
Thank you.
Remember, you're still filming.